Sonali. We are happy to have you here.
Thanks, everybody. So I'm quite delighted to be with you all and talk about such an interesting and relevant topic. So while Bolt is an experience design studio, that means we use techniques like service design and agile implementation to help service providers to deliver what we believe should be a signature service experience, today being customer-centric. So I work with a partner. My expertise is in the human aspect of experience design. My partner Simran is a digital expert because today there is no experience that doesn't use human as well as digital technology-driven touch points. So it's so important for us to combine our expertise of 35 years to help all kinds of businesses to truly learn to engage the customer. I also wrote an article, it just came out of the blue, for the orthodontics, the APOS journal, and it was actually an eye-opener for me that medical practitioners want to learn how to communicate. So this was on more soft skills, how to establish trust in few minutes. So it was a communication guide for medical practitioners. And a lot of people gave very positive feedback on this article. So that's a little bit about me. As I mentioned, I work across genres, and healthcare today has become such an interesting space because more and more healthcare providers are aware that the patient experience is critical to their success. So we're using the word patient experience. Let's first define it. I'm going to start broad to give a perspective, okay? So Apple, right? Apple is a brand that everybody knows. And also, just to set context, even though we don't have a very long session, I really want to make it interactive. So I will ask questions, and if you can answer, just unmute yourself and then you can go back on mute, okay? So this is supposed to be interactive and informal. So would someone like to tell me that why has Apple kind of got this such a leader advantage, and what makes them stand out? Who has an Apple phone here in the audience?
Hi, this is Priyank here.
Hi.
I believe the positioning that they have created in terms of a great product experience and integrated hardware with the marrying that with the software experience. So the complete UX is very tied up with the hardware, and that leads to very great design experience. So the experience that they are able to provide to their customers, that I believe is a key differentiating factor for them.
Absolutely, it's very well said. They're really about that integrated experience. I mean, everything, firstly, the product is keeping the user in mind. And if here we don't have direct Apple stores. When you all travel, if you've been to an Apple store, this is the kind of vibe when you walk in on a weekend. They have these Apple experience experts, and it's high touch and interactive and consultative, and you don't want to leave the store. They make sure billing is on the go. You don't have long waiting lines. They have given so much importance to how the customer experiences their brand. They don't stop at just providing a great product. And this is just one example. We have many such brands. I mean, look at Starbucks, right? Look at Amazon. They call themselves experience brands. And this is because customer experience is the next competitive battleground for businesses to win over customers. And this pandemic has taught us all the more, because today the customer experience is at a different level because people's expectations have changed in terms of efficiency and speed and on-demand convenience. So if people are changing, and your patients after all are people, so if people are changing, then even your patients are changing, right? So patient experience sometimes gets a bit left behind. And today, when the whole world is trying to understand their users and cater to the users, the question is, what about the patient experience? Well, the patient experience certainly matters. By 2020, 88% of healthcare companies will be competing on the basis of experience. And according to Deloitte, the higher patient experience rate, actually they are associated with higher profitability, okay, with like standard They said hospitals have 1.8%. You can achieve higher margins. But these are just numbers. Numbers are, of course, important because some of us relate with numbers. But in the end, we're looking at long-term, the intangible satisfaction. As your satisfaction increases, your employee satisfaction also increases. I want to bring this different lens to the experience. So the word experience, what exactly is it? Well, at the middle of everything, imagine your patient's needs, right? Everything we do is to treat the patient. So the focus is on treatment. But today, treatment, if you compare yourself to a product like an Apple, treatment is your phone. Treatment is core. Treatment is why people come to you, because you're reputed and you have qualified doctors and you have infrastructure and facilities. But today, a lot of people have that. How are you going to differentiate? And it's not necessarily enough to make your patient happy. You need to add value. And that third circle is value-added services. So if you wanted to define an experience, you could say, it's my patient's needs are being catered to by my core treatment or service plus value-added services. So that entirety makes an experience. So an experience is holistic. It's not just taking an appointment, it's smiling, building a rapport, minimizing wait times. It's not just what you do. An experience helps you define how you want to do it. Another way to define an experience is through a journey view. And the journey view I find super useful to help us structure and detail out experiences, because experiences are complex. So typically, any kind of interaction can be mapped as a journey. There's always the before, when a patient maybe becomes aware of your hospital. It could be through a friend, it could be because it's in a shared location, a referral, a website, through a doctor's reference. And then they make an appointment, and then the during is when there's the direct interaction around the treatment. And even once the treatment is over, there's an after, which is the maintenance, the long-term care, the relationship. So it's so important to be able to break down any kind of experience into a series of what we call a touch point. A touch point is a useful word. It defines anything between your business, any point of interaction between your business and the person who's using your business. A touch point can be digital. It can be a human being. It can be physical, like, your clinic room is physical. If you have like a person on the phone, right, they're actually a human being, and so on and so forth. So there are all kinds of touch points. In fact, every touch point has dimensions. There's an emotional element to what the patient is experiencing. That is that feeling of being cared for. Patients want to be treated like human beings, as individuals, not as just another number. They want trust, they want transparency, they want assurance. Then there's a functional, like the doctor's expertise, his experience, the equipment, the hygiene. It's as important, right? So there's emotion, there's functional. But every touch point is also sensorial. So when I come in and I see my environment, what does it look like? How's it smelling? And so on and so forth. So really, the truth is that every touch point can be improved on different dimensions. Another perspective while defining the patient experience is, the stakeholders. A patient experience has multiple stakeholders. That adds to the complexity. But to really define a good patient experience, nobody can be left behind. In this simple diagrams, just to demonstrate, the patient is the central point, And you can see the numerous interactions. It's not just the patient. Today, as a best practice, people look at the patient, but they look at the needs also of the family members, because they are equally patients, maybe not primary, but they are your secondary users. So on an administration level, there are reception desks and billing desks and insurance agents and pharmacists, and then diagnostic centers. There are different kind of nurses at different times. You could have a general doctor, a specialized doctor. There's a nutritionist who comes and interacts in a hospital. There could be a help desk for problems, a call center, like assistance to doctors. I mean, a patient and their family are actually interfacing with multiple stakeholders across different departments. And this bubble is just the front line. There is an entire back office, back end, behind the scenes team that is processing and supporting all these people, right? And actually, everybody's actions, thoughts, and feelings help create that experience and impact the life of the patient. So, in summary, the patient experience is patient-centric. We always put the patient in the center. That helps us build empathy. Empathy is the cornerstone of experience design. Then, another way to look at your patient experience is through a sequence of actions and moments put together. Always remember to look at the physical, human, and digital aspects of those interactions. Walk through that journey from a patient's perspective. It is too easy to say, we did this, we collected the samples. It's the challenge is to look at the journey as a patient. That is empathy. So the patient calls up, the patient is waiting, the patient is nervous, the patient is looking for the doctor to answer questions, the patient doesn't understand his prescription. So that patient perspective. And then also remember to always chart out all the stakeholders involved and go horizontally department to department. So even though the patient may be only primarily interacting with one department, you need to involve all those other departments that indirectly also impact that patient's experience. And for your hospital, when you really look at your patient experience as a culture, it's very important that everybody takes responsibility and everybody is motivated to deliver this experience. So this is a way to really understand and define the patient experience. So I've spoken, and now I'd like to throw a question out that, we all know, I know you all do know that patient experience is important. Today, I think in a way it's common knowledge, but still we do know it's very challenging for hospitals to get there. And a lot of the times people are saying that the way other more consumer-friendly industries are evolving, why still for a lot of patients to, enter that hospital and have that experience, it still may not create a level of satisfaction or joy that they expect. So I have summarized a few challenges, but it'd be nicer to hear from you all. What do you believe are the challenges that you know of or that you face in the endeavor to create a better patient experience? Anybody would love to hear from you. Please just unmute yourself and speak. So, one of the things we find is that hospitals historically have very rigid protocols, and it's not wrong, they have to, because of the nature of the work being so precise and it puts life at risk. But still, because of that, they are so focused on protocol, they forget the patient's feelings and perspective at the same time. So that is a mindset shift that needs to occur. Okay, so that actually covers protocols. And then again, number 2, when I talk about mindset, let's jump into functional mindset. So number 2 talks about the functional mindset. So who delivers an experience? While we talk a lot about the patient being at the center, but it is the hospital staff that need to have that empathy. They need to realize that it's a patient-first attitude that has to drive their work, but some of their mindset is also functional first. Okay, so both these things are really cultural. Another thing is that hospitals work in silos, so it is very departmental kind of focused, and everybody has their clusters. And so communication can be an issue. In fact, I was in hospital earlier this year, and I do remember that frustration that every time you're moving from, department to department, you're kind of being asked many questions again and again, So sometimes that seamlessness of information or the patient's situation and story, and it could be a sensitive one, is missing. The other thing is that healthcare workers are burnt out. I mean, this year and in general. So when your service providers are not motivated, they are going to be in that number 2, functional mindset. Okay, so they need to be also treated with empathy and understanding so that they can bring out that desire to serve the patient better. Adoption of technology is generally slow. Is something that we've seen, okay, because there is like a lot of, how do I say, not resistance to change, but there is a comfort level. So if, waiting, they say, I was reading this interesting article that about a case study, which I will share with you, and how they transform the waiting room experience and appointment times. And they said, why didn't they do it earlier? They didn't do it because waiting for an appointment is part of the normal way of interacting in healthcare. So because everybody's doing it, then everybody thinks it's okay till you find a way, a breakthrough way to change that. And of course, because of whatever reasons and circumstances, very often the patient does become a number where there is not that moment or opportunity to build that rapport, build that relationship and that personal connection, So while there even might be empathy, unless we express it, the patient still feels like a number, okay? So this is roughly the kind of challenges that one might feel they are encountering. I can assure you it is quite normal and across, I would say, healthcare and hospitals. Okay, so Vivian, if you could pop the questions, I'll just give a context before that. Are you patient ready? Is just 4 simple questions to really it's a way of, in an interactive way, highlighting some of the, I would say, approach, mindset, processes you would need if you wanted to delve into patient experience design. Yeah, so they're going to come in the format of polls, and all you need to do is multiple choice. All you need to do is choose the right answer, and we'll go through them, and I will then debrief these questions.
Yes, Sonali, the poll is live. Everyone, we request you to please look at your screens and select the options most relevant to you.
So there are 4 questions. You can scroll down and answer all. So thank you for whoever participated. Let's just quickly see what we believe is the best answer. The idea of the question is to actually make you think about your situation. So ideally, a patient experience at your hospital is the last one, while it's not wrong, anyone who's marked the second last one, but it is not just the medical treatment, the personal preferences of the patient, the emotional needs of the patient, but also their family. Okay, today the best practice is to understand that the patient's experience extends to how their family is being treated, them knowing when to wait, what to say, getting the information, alleviating the stress of the entire unit as a team. The second, so we talk about at what level does patient empathy exist across the organization, okay? So definitely, so this could be all, there's no wrong answer because you may be looking at your experience. Definitely the front end nurses and doctors will have the maximum empathy, right? But actually in some situations, depends on the culture, every patient facing employee has or should have. But to have the third situation, which is ideal, that every employee of the hospital feels that patient-centric mindset and empathy and understanding over the patient is going through. So there's going to be a lot of smoother teamwork and collaboration also happening. Okay, for that, then there is a need for what they call empathy training. It may not always happen at the back end. In fact, the back end can somehow get left behind, and that is a practical truth. In this third situation, how often do key team members across departments meet? So when you're saying regularly, that is fantastic. And if you're saying rarely, great, you're being honest. And the truth is that cross-functional discussion, sharing, collaboration is integral to a complex environment like a hospital. And if it's happening rarely, at least it's happening. All you need to do is make it like a sacrosanct moment when the team comes together. Don't leave it to chance. how do you manage patient feedback? I think we all agree how important it is. So if you're capturing and acting, well done. Okay, capturing and not always acting, well, it's happened to me as a patient, and I understand. So to really explain that is not ideal, because the first thing patient thinks, as you would if you're a consumer or a patient, why do they ask me if there's no action, there's no feedback, right? So to motivate even the patient to be a part of that journey, it's very important. If we should in a way get back to them, and we should process the feedback, okay? And not capturing is okay, a reality, but there are very simple ways that you can. Okay, so great. Thank you everybody for participating in that. So now coming back to, are you patient ready? What we've spoken about, like measuring the feedback of your patient, having those right processes, this is just the surface of what we're going to talk about. Okay, let's look at some case studies before we get into method. I've chosen, these could be familiar, not familiar. There are many smaller hospitals, like I would say US and Europe, that are doing experience design. It's not so easy to get those details and information. And so I thought, let's just talk about the two big ones, because there's a lot of interesting details and case study information available. It's easier to demonstrate what we mean. I know that Mayo Clinic and Cleveland Clinic are the two. They're ranked like in the top 2 or 3 hospitals regularly in the US. And while you will say that I don't have the bandwidth or need to scale or technology appetite, so this is just a case study to learn. It's not a cut, copy, paste situation, and neither are we prescribing anything that they are doing. They are doing it based on their patient situation. But it was very inspiring and interesting. So for Mayo Clinic, I'm sure you'll have heard of it. And of course, they're using a big blend of technology, all the more because of the pandemic. And they have 3 clinics across the United States. So first, I thought, let's look at the methods they use to get where they got. And then let's look at some of the service innovation they have done. And remember, I'm not talking about medical or treatment expertise. That's not my area of expertise. The focus of these cases is the experience, okay? So quality at Mayo Clinic involves the totality of a patient's experience. So this is their philosophy. It is like the first phone call to the last appointment, and they understand the importance of consistency across touch points. They have a dedicated patient experience team. Each center has a team which reports into the central patient experience team, and is a combination of a manager who has the whole business, design, soft aspect, and a medical expert. So together they design the experience, because both things are intertwined, and they work as consultants, co-creating solutions with hospital staff. They educate their providers with first-hand stories of patient experience to build empathy. They do activities like look into a day in the life of a patient, observations, just silent observations of physicians and patients interacting. And for the last 20 years, they have been consistently conducting patient experience surveys. They also, whenever they do ideation to solve problems, they use a classic service design technique of prototyping, like low fidelity, low cost prototyping, and getting quick patient feedback before actually implementing. And their measures of patient experience are so interesting. They look at the amount of time spent with the patient and how, with respect, a Mayo team member treats the patient. Appointment should be on time. Patient information should be available real time, almost real time, to every doctor on demand to create that seamlessness. So some of the methods they use has driven these innovative solutions. They're experts in space design, artifacts, graphics, text, digital signage, creating private niches, looking at the way patients and physicians are interacting. They actually create an environment that enhances the way they work. something they had, and I've just highlighted like some of the interesting ones. I mean, there are tons and tons of material on this. And the patient rooms have movable furniture. They did something as simple as creating a round table, so that when the doctor and the patient, they're sitting and sharing, looking at a screen, sharing reports, they can actually sit face to face instead of like a desk, and that little interaction that both can look together actually help the patient feel part of the process and feel included. They have one-pager medicine guides that give details about the side effects and the importance, because they feel that patient compliance has increased because they know patients are going to Google this stuff anyway and get scared. They have self-check-in kiosks. The way in an airport today you can do that web check-in, it gives patients better control and helps minimize waiting time in the reception. They created a Mayo Clinic platform that uses artificial intelligence and data to provide like basic care. And in the pandemic, they tied up with a partner, Medically Home, to give advanced care at home programs. They have this central access center which collects all the patient appointments. So today patients are online, WhatsApping, messaging, calling, like in panic trying to get appointments, and then you have repeat appointments. So they found a way to integrate that data. And the Mayo app is supposed to be one of the best apps. Their app helps patients to book appointments, find their past records, lab results. It educates them. They can tailor make based on their condition to get relevant information. Symptom checkers for basic symptoms to know which kind of doctor they need to go to, and then they can pay a fee for the month and get a human healthcare assistant to guide them. They do payments on it, they can chat. So all these things, while they sound high tech, but what I liked is that it's about really having that heart of empathy for the patient. That is the start of everything. Cleveland Clinic, while similar but still different in the way, also have a dedicated patient experience team. So their philosophy is patient first. It's a guiding principle. Their Office of Patient Experience was launched in 2006 when they lost a patient who came because for a heart surgery, but they felt they didn't like the empathy and the behavior. And this really shocked the hospital. And that from that time, they made an endeavor and they hired a chief experience officer, and you can find this person online in a lot of YouTube videos and talking about patient experience. It's very interesting. So she started patient surveys and ratings, actually talking and listening to patients and families, and having experts in all the hospital domain to all the time observe and gather feedback. So they do a cross horizontal observation at a unit level observation. And they look at the best practice internally and share it across the hospital, but they also benchmark global trends. And they do empathy training. I think they're like 66,000 employees into empathy training for everybody. In fact, today, because millennials, and I don't even know that much about the younger Gen Z, but millennials want to interact with hospitals the way they interact in life, like chats and emails and on demand. So they did a millennial empathy training for their team. Some of the things is like they started a same-day appointment. I don't have time to talk about this in detail, but it was super interesting. The way they imagine greeting someone who calls your hospital saying, "Would you like to be seen today?" But of course, they have a filter of how they do it. But this was a game changer. Then they do this how medicine communication in detail. They have done purposeful hourly rounding of nurses so that people, patients never feel abandoned, that they need to put the light on to call. Then there's a leadership rounding where leaders go occasionally to get feedback. They have this empathy communication, so they call it Communicate with Heart program, which is training on service behaviors. They do shared medical appointments because this came out of an empathy exercise where they understood patients with certain unique conditions want to meet other patients and have joint sessions with their doctors. They started a distant health program for outpatient, inpatient care. I spoke about the millennial empathy. You can get an online second opinion from a My Consult button. a lot of transparency, allowing patients to rate and post comments, and then they use artificial intelligence to sort through the feedback. Okay, great. So if you all found this interesting, I can assure you there's tons of interesting video content also. Because of the interest of time, I didn't show some interviews, but it's really interesting because they've obviously learned a lot and they're very evolved in the way they are handling the patient experience. So while your context is different, I can assure you the principles of design are the same. No matter how big or small your hospital is, you're still going to listen and interact and observe, and your solutions may not have that level of investment, but your solutions will come with that same heart to make your patient's life better. So now let's talk about methods, how to reimagine your patient experience. I've spoken a lot about service design, or we can call it experience design. They're interchangeable. The method we recommend is the experience design, which is organizing resources to improve service interaction between the provider and the user. Okay, what does that mean? Typically, the method has 3-step approach. The first phase is simply put, discover the needs. For that, you talk to multiple stakeholders, you use the research and data available to you, you use dialogue and empathy to understand really what the needs are, and you can create a tool called patient persona. Okay, so patient personas, I'm going to get into more detail. Patient personas help you capture the intangible nature of customers' needs. Okay, you're like, empathy is a feeling. It's very hard to capture it and make it actionable. But once you know what your patient needs, you can start designing. A patient journey map is a great way to design and fill the gaps that the patient is experiencing. Okay, so you have those ideas. When you have fresh ideas of improvement, you prototype and test them, even like paper and very quick and dirty prototyping before you actually invest in changes. That is the agile method of change. A service blueprint is a tool which helps you now understand internally how you can improve your processes to achieve that ideal journey. But I'm not going to get into detail of the service blueprint because I think it's too much information for today. Once I have a rough idea of my experience, I get into delivery. I have to create those new service protocols, do empathy training, make sure that they're cross-functionally collaborating, empower the team to deliver, do the soft skill training, and then if you need technology and other things, you need vendors or internally, you need a way to develop it. So discover and design and deliver. Experience design is a systematic phase-wise approach. Benefits, actually not only you increase patient satisfaction, but employees feel they're part of the process because it's a co-creation. All the key stakeholders have to give their inputs and be there. They are more likely to implement the solutions because they themselves are creating solutions. When you do this, you eliminate process efficiency. So while you're trying to please the patient, but when you redesign, you also redesign how you're delivering. As I said, your solutions are going to be realistic because you're testing them with the users, with your employees, and you will look at efficiency metrics as well. Through this design process, you become not just a hospital, but a brand that is standing for a certain kind of service. We call that your competitive advantage or a point of differentiation, or that value that you're adding to the patient. And staff will be more willing because you are not just dumping these ideas on them, you're involving them in the process. So just to give you, that was a background of experience design. Today, in the interest of our time, I want to talk about 2 tools in a little more, because these 2 tools, the patient persona and a journey, actually they're so simple. I believe that it's very DIY. Anybody can do it themselves if they are interested. Okay. So a patient persona is to capture patient expectations. Here I have a list of general ones, but every patient and every context is different. In general, people want more personalized care, pleasing environment, at-home services, information on demand, tech-enabled convenience, minimum waiting. They want to have a voice. The patient wants to express their needs. They want one-point contact, seamless coordination, high standards of hygiene. I mean, this is just some of the mounting expectations. So to understand the patient's need for our situation, we need to build direct empathy. We all know empathy is the ability to understand and share the feelings of another person, even if we may not have gone through that same surgery. To do this, I'm sharing this easy to remember research method. These are just tools you can use. You can use this, it costs nothing. You can use this in your context, whatever size your hospital and team is. SORI. So it's a way to remember. What are the 4 different methods? You can, if you don't have a survey for feedback, float a survey. Okay, you can use a free tool like Google Survey or SurveyMonkey. Float a survey for your patients, even your internal key stakeholders. Go online, check reviews. Today, patients are very vocal. So basically, use whatever data you have and comments you have to know what is my patient feeling. Then do observation. So you can do live observation, or then if you have in past, it's okay. But if you haven't, like that means when you see a patient is interacting, you need to have one person who's observing, because the person who is treating the patient or interact with the patient cannot be an objective observer and observe every aspect, the emotional, functional, all the nuances of that particular interaction, even the space, what are the patients. One hospital discovered that giving patient control over the AC temperature was a game changer, and giving external AC control to the nurses was a game changer, so they didn't have to enter to disturb the patient to say put the lights off and so forth. So it was interesting. You can do role plays, so to enact certain interactions, become the patient, and you can do role plays within your team. If you feel a team member doesn't have empathy, you can run them through role plays. And interviews. Finally, sit with your patients, old patients, unhappy patients, go back, ask them why they don't come back if they haven't, and all your current patients, do interviews either on the phone or face-to-face. Of course, face-to-face is better, but may not be possible today. And ask them very open-ended questions about and not being defensive, and just listening to what they feel and what could have been improved and so on and so forth. So while patients may not be able to tell you the solution, they can surely tell you their pain points. What you do with this research is you translate it into a tool called a persona. A persona is a fictional character that represents a set of patients that will react to your service in a similar way. So basically a persona just, you're going to have 1,000 different kind of patients. You need to club similar patients together, and then you need to create that fictional character, because you can't design unless you know who you're talking to. You need a face in front of you. So personas are very useful. So I'm going to give you an example. So for me, the young professional millennial was this guy called Jay. Okay, he's more into online research, efficiency, time bound. He needs work, like he needs to do his medical around his flexibility. Okay, and he's very happy to book things online and wants on demand. But here we have Seema, who needs some medical care for her daughter Sohana. She is more high touch, face to face. She needs to build trust. She wants to meet the doctor. She wants that you spend time and comfort care, and she wants that recognition. So patients are different, okay? And I'm not just, age is not the only thing that differentiates, okay? You may find your personas are unique to you. It could be by treatment, it could be outpatient, it doesn't matter. How you categorize is a process also. You have to think through and see what are the different groups of personas. But to start with, only deal with 2 or 3. And then as you become better at patient, you can then personalize. But first you must design for your core personas. This is a persona format. It's very simple and very flexible. I like to give a category, so this guy is high-tech guy. A description, to have a personal idea who he is, what he's going through. He has a back injury. Because of his busy work schedule, he has not been able to address it. What are his goals? What are his needs? So just he may need flexible payment options, he needs affordable budget treatment, he likes digital solutions, he's quite detail oriented, like he wants that product knowledge, he wants to know doctor credentials, he's a fact guy, okay? And sometimes I put a quote to help just bring that essence of that persona out. So Jay could represent a group of people, and knowing what he needs is very helpful. So that's an example of a persona. But once I have a persona, now suppose I want to solve for a person like Jay, I will create the journey map for Jay. Jay becomes my baseline journey map. And then if I want to add different features for different kind of people, I will slowly add, okay? Your patient journey, basically it's your experience translated into a sequence of behaviors. So like there's a before, there's a during, there's an after, right? From doing the research, making the appointment, coming, examination, test, so an after, prescription, follow-up, care. It's a sequence. This is just an example. If you Google patient journey map, you'll get many types. It's basically to capture the scenario of the persona. What are they doing phase-wise? What are they thinking? What are they feeling? And those smiley faces are a way to understand when the patient is happy or unhappy. This is how we work: chart paper, post-its, creating the journey map. Just to break it up, you need the phases, you need patient actions, capture their feelings, and then the opportunities for better design. How are you going to do it? Get the tools, build a team of stakeholders, choose the persona you want to design for, create the structure, and just walk through, put yourself, I am Jay, and now walk through. The patient journey is from the patient's perspective. One thought or action per post-it. For a logical sequence, here's an example, very tiny example, just the appointment. He visits a website, he calls a help desk, answers some questions, gets a confirmation, and he doesn't get a reminder. What is he thinking? He has feelings, and those feelings come with emotions. He's happy, he's neutral, he's unhappy. Now I'm going to brainstorm with my team and redesign. Let me give easier access on the website. Is my number visible? Faster response time, better quality communication. Can I add a reminder notification? How can I personalize? How can I add value to Jay's experience and fill his gaps? Now, of course, the simplistic example. Great. So, when we redesign the patient experience, our endeavor and focus is to cater to the unique needs of the persona. Okay. So, my last slide before we take questions is that what would you do next if you wanted to start patient experience design? Your next steps. First, identify someone who can drive it. It is a process like all the other processes of your hospital. Find someone who you believe is empathetic, or hire an actual design person like a service designer. It could be just part-time, like a consultant. Like sometimes I go into businesses for just a few weeks or a few hours a month, or do workshops, and then they do the rest. Either way, but you need someone. So if you believe you have someone internally, they could be trained. And once they learn the design process, they can train other people. You can build the capability internally. You can bring an external consultant. And if you feel you're large enough, you can get a full-time experienced designer who will work across your departments with all your stakeholders. Conduct research, build the personas, create the journey maps, and identify the key pain points. So actually creating a persona journey map is actually a half-day workshop. Okay, I'm making it sound like big. It's the research, maybe takes you a few weeks, time box it, because you can go on. Brainstorm on how you can improve it, and then come up with those new ideas, test it with patients, and you're done. Okay? So any questions? I know some of this could be a little new for some of you also. Anything that you all would like to know, comments also. I hope you all found it interesting. I thought there could be a little assignment. Happy to give you all one, but I thought let me hear from you whether you think this is something that you could try, or any questions or clarifications. Someone has asked for the PowerPoint. I will send a summary, and I know it's very innovative and different way of thinking. So I completely understand that, and that's why I appreciate your participation actually. But I'll give you all a moment to think. Vivian, any questions on the chat or anything you would like to add?
Hi Sonali, this is Vandana here. Can I ask a question?
Yes, please.
Yeah, so really great presentation and very innovative, as our cohort members have pointed out. So to start with, let's say if the team you mentioned would need to identify a designer, like an internal team member, who do you recommend should these be? Like from which category?
Yeah, so ideally it would be, I think, I don't like to slot people because sometimes I feel human-centered is something, Vandana, I have seen everybody has the potential actually. So what I'm saying is that, but ideally, if you believe someone who is like from a medical background may have a very fixed point of view about how hospital thing works, and a very functional point of view. So that will be more difficult for them to go back and because when you're getting to patient experience design, you need to have a blank slate. You have to set that reset button to build that empathy. So ideally, it would be interesting. I know all hospitals are different, but if you have someone more from a general management background, or someone who is doing already some kind of patient care. Like if you have someone who is more on the patient care side, dealing with patient interaction already, they will be able to understand this concept easier. And then once they learn how to facilitate, how to put together, how to organize, I feel they will be able to grasp. And you don't need a very senior management. Today you have young designers working in hospitals. I mean, when I was living in Milan, when we were doing our masters and stuff, I had so many of us who were like doing internships at hospitals, and working in design teams, changing the way children's nutrition planning and creating ways where, in pediatrics, the children were enjoying things and Superman characters. I mean, just, the solutions were all kinds. But what I'm saying is you don't need a very senior person also. Yeah, does that answer your question?
Yes. So I think maybe if somebody in the cohort would like to sort of reflect on this, who do you think would be a team member from your hospital or your setup? That would be interesting. Yeah.
Any other questions? I would like to ask you all a question before we close.
So Sonali, Pratyush this side. So I think one of the nowadays everything is being virtual, like there are virtual interactions with the patient. So what do you think, like in terms of patient experience, delivering the care in a virtual way, how big a role patient experience in that sense can play?
Very. So the mode of delivery doesn't matter. See, empathy and a better experience can be through, it's like saying I was doing face-to-face workshops, say today I'm doing virtually, right? It's just the situation has changed. So if I have to build rapport and empathy and ask questions in a soft way and change my communication, whether it's face-to-face or phone, it's the same. In fact, phone, you'll just have a different experience. So right then there will be technology will come into mind. How is he going to get that appointment? What if the appointment is delayed? How do I send information post that to confirm things in the mind of my patient, right? So there'll be different touch points of communication. And then even in virtual, do I stay in touch? Do I send notifications? Do I follow up? What if I'm doing a virtual consult with a patient and then I pass them on to someone else? Okay, do I take responsibility for that? So I feel the dynamics are the same. Okay, the patient experience is as complex. And today it's more complex because it's hybrid. So the virtual patient may then come into the hospital. So you have to do hybrid patient design also, because then your data also has to be stored, right? In a way that where your patient is interacting on virtually or in hospital. So actually that has created more complexity.
Correct. And I think this is something which all the hospital leaders have to think it through, thoroughly. Earlier, virtual care was very, very limited, but the corona crisis has made this also very, very critical with respect to patient experience. So I think virtual care, hybrid care, as you are pointing out, is something which, all of us have to think it through. So I completely agree with you. Thanks for responding.
Anybody else would like to say something? I would like to know from you all if you all are feeling not in the mood to unmute, no pressure, but even just by show of the hand tool, and there's a hand tool down in the bar, but show of hand tool, would love to know how many of you are interested in exploring this. Just openness, right? And that kind of gives us and the Wadhwani team some input, that we're sharing with you knowledge and expertise that is useful. So while I understand that it could be very new and you need to absorb it, okay, at least they know that you need more support. Like, for example, would you like to do a workshop where you actually create a persona? Like actually come and create a tool? Or, would you like to have a customized workshop for your team where you and your stakeholders learn to really apply few basic tools? So if that is of interest, it would be great. You can unmute, you can say yes in the chat, you can show of hand, but do give us that feedback, I'm going to send you all guys this deck. I've created a template of a persona. If you believe there's an activity you'd like to do, I'll share my email. Okay, it's sonali.gogia@boltworks.in. Of course, the Wadhwani team has my number and other things. If you all would like to ask me any private questions or personal questions, okay, it's interesting for me also, because recently I was just while we've been doing this Wadhwani, there have been a lot of different healthcare startups, and I think the patient experience has become a hot topic. So I definitely think it's relevant. I think that everybody's on a different journey of that curve, but it doesn't matter. Human-centered design, if you're in a 10-person team or 100-person team or 1,000-person team, there's value in it. So happy to share this. I hope you all found it valuable, and thank you everybody, and thanks the Wadhwani team for organizing this session.
Thank you, Ms. Sonali, for the wonderful session. On behalf of the TransformHealth team, we urge all of you to take the knowledge and the understanding that you have had today and to implement the same in your respective hospitals and institutions. We will share with you the template to plan the next steps, and at the same time we also request all of you to take advantage of the pro bono one-to-one support that we are extending to all of you as a part of TransformHealth. Once again, thanks a lot, Sonali, and I am sure that the audience got a number of great insights. Thanks a lot for your time and for a wonderful session.